Hello friends, I'm Dr. Sunil Saini, trauma and laser surgeon, expert in limb lengthening, deformity correction, pain management, ozone therapies and hydrogen therapies. Today we have a patient who is suffering from chronic backache with bilateral lower limb radiculopathy. And she is also a candidate who had done total knee replacement only 6 months back, and after total knee replacement still she is not able to get pain free. So she did total knee replacement considering that once the pain will go off and she will be able to walk. Presently she is not even able to walk few steps, even 100 steps become very much painful. So why this has happened? Because she had major problem in her spine. So whenever the patient is having both things, so why this has happened, that in spite of doing total knee replacement, still she is having very severe pain and she is not even able to walk. This happened because she also had problem in her spine, and if when I am seeing her spine, she has listhesis, she has deformity, and there is L4, L5 disc prolapse, if significant disc prolapse and significant canal stenosis. Now, what is canal stenosis? When the nerve, the area through which the nerve are exiting, if that space get decreased, that is called canal stenosis. That is the reason she is able to sit. Whenever she is sitting, there is no pain, but whenever she is walking, it becomes very painful, very painful, and she is not even able to walk more than 100 steps. So whenever such kind of situations occur, the patient is having backache also, patient is having knee osteoarthritis also. So basically it's a chronic degenerative disease which is affecting her spine as well as affecting her knee also. Now she did total knee replacement considering that she will be pain free, but that does not happen. She is walking but with pain. Whenever she is walking 100 steps, pain become more severe and she need to sit. So on her MRI there is L4, L5 disc prolapse, there is L3, L4 disc prolapse. And now what we are planning? We are planning to go for intradiscal ozone nucleolysis, although there is no disc, but it will act as an analgesic, anti-inflammatory. It will also help in shrinkage of the disc as well as help in relieving the canal stenosis. How? So when it decreases the inflammation, the canal inflammation also subside. Whenever we are injecting inside the disc, we will also inject inside the foramen. So in foramen, the interforaminal inflammation will go off and then patient will get relieved. So first our aim is to relieve the pain. Once the inflammation will go off, and then she will be able to walk. Along with that, whenever there is a chronic degenerative condition, we also add Mukherjee regimen, which is very important, so that she will be pain free for a longer period of time. And along with that, we will go for ozone autohemotherapy or EBO also. So this is the integrated approach which we need to follow for such patients so that we can prevent any surgical intervention. There is no need of surgical intervention. Also, there is grade 1 list. So now we are going for intradiscal ozone nucleolysis plus DSCB injections or physiological pain portals, followed by ozone autohemotherapy, and then she will be on Mukherjee regime to handle the degenerative spine disease. That is the integrated approach which we need to follow in such kind of patients. So already TKR done, still she is not able to walk and her spine is bad. Now we are going for the intradiscal approach. The patient is in the prone position. This is our standard position, and now we are preparing everything and we'll go for intradiscal ozone. And this is called draping, painting and draping. Standard painting and draping done. You can see here there is already there is a deformity, scoliotic deformity is there, and L3 and L4, the L3 space is so much reduced here. Okay, काफ़ी खराब है spine. नीचे आ जाओ. Shoot, it's a degenerative spine. This is L4 disc. नीचे की तरफ आ जाइए. Shoot. Now I'm giving local anesthesia. So skin has been infiltrated and now good amount of local anesthesia given. We are going at 2 levels. You can see here, this is the dye which we have put between the disc. Now this is basically disc. Annulus tear is there, that's why it is coming out, and this is the disc prolapse. So now you can see here, this is L3 and this is L4, deformity is there, and if you see this, if you can appreciate this dark thing, that is the dye, and it is taking the shape of disc. Already annulus fibrous is not there, that's why there is leakage. Now we'll go at second level. So now we have confirmed with the help of dye, and now we are just putting bit of locks and we will go with ozone now. थोड़ा सा दर्द फील हो सकता है आपको. Okay, so this is my ozone going, and this is what we call as ozone nucleolysis. So we are doing at 2 levels. So now we are going for ozone. ठीक है. We have finished interdiscal ozone nucleolysis. We have given DSCB. Now we are going for lower limb physiological pain portal, or call it DSCB, routinely beta 1, 2, 3, 4, 5. I always augment intradiscal ozone nucleolysis with physiological pain portals, followed by physio rehabilitation, lifestyle modification, and dietary changes. Patient need to prevent excessive strenuous exercises for next 7 to 21 days. Otherwise, they can do the routine work and they can even go to office after 2 to 3 days.